Meanwhile, South Africa's health ministry is insisting that there is no need to panic about the Omicron variant, which was detected in the country. And this follows President Cyril Ramaphosa's condemnation of a travel ban imposed by several countries. Health Minister Joe Pala said the country had been here before, referring to the Beta variant, which was also identified in South Africa last December. The UK, EU and US are among those who have imposed travel bans, with Japan becoming the latest to shut their borders. Well, African countries, including Rwanda and Angola, have also joined in this measure by restricting flights to and from South Africa.
Our medical scientists, our epidemiologists, our clinicians are working daily, hourly, studying this virus, its characteristics, and its impact on us as human beings, as citizens. Among the things which the President outlined yesterday that we still have to understand, led by our scientists, such as the transmissibility of this virus. That's a matter which our scientists and epidemiologists are working on, whether there is any age differentiation in terms of its transmissibility and illness, whether there is increased reinfection for those who had already been infected before, and including also breakthrough infections for those of us who are already vaccinated, and also to the extent to which the vaccines remain of serious protection. All these matters, what the President outlined as work in progress. We can be rest assured that it's a matter of days and weeks, our scientists will have actually gone to the bottom of this. But in the meantime, we are doing everything possible to make sure that our health facilities are ready. We know that as the infections rise, people will get sick, some will get severe, especially those who have not been vaccinated. But we know that there will also be incidences where even those who are vaccinated may get ill, and the health facilities should be ready. And that's why we have a Gauteng representative here, just to shed light as the epicenter currently of this the variant, to give us a sense of the readiness of the health facilities.
More on this, we're joined by Professor Lekon Aya-Yusuf, who's a DVC researcher of Makato Health Sciences University in South Africa. It's good to have you on the program, Prof. Our previous guest referenced what he called media hype, and he said people should not panic. But you are on ground in South Africa. What's the situation like, really, with this new variant? Has anything changed considerably?
Nothing has changed. And good evening to your viewers. I agree with that sentiment. I must say I was personally shocked and disappointed when I saw the response from countries, and even worse still, from countries in Africa. I just had my flight to Lagos through Rwanda cancelled through an email I received earlier in the day. Now, I have said it many times that we have to learn to live with the virus. Learning to live with the virus means we should stop headlining anytime we have infections or a variant. It is expected, once we don't get the speed in vaccinating the population as we have in Africa, the virus is going to mutate because it's going to be moving from one person to another. It has the opportunity to mutate. So at the end of the day, the message remains the same. What is going to eventually happen is a function of how we comply with these non-pharmacological interventions, like putting on our face mask every time, ensuring physical distance, and washing our hands or sanitizing our hands. And on the one hand, expected from us. On the other hand, is we need to vaccinate. Because living with the virus essentially means you're going to get infected, just like you have flu, but you're not going to go into a hospital, or you're going to die, or you're not going to die. So, and this is more likely what we're going to see for many years to come.
So, I mean, this new variant changes a lot of optics on COVID-19. We've seen, as you referenced, the travel restrictions, and I sort of wonder what the options are for you now. I mean, you're just one of a lot of other people that are going through this, and you sort of wonder how this is going to affect things. So, the WHO has spoken against, these restrictions, South Africa. Even Nigeria has backed South Africa on this. But let's be honest here, if the roles were flipped, what kind of response would you have expected from these countries, really?
Well, I would have expected them to apply science. The science that we have currently is that, yes, there's a variant, but we do not know whether it's more transmissible. In fact, today, the latest data we have suggests it might be less transmissible, but it has an affinity to reinfect those who are previously infected. And we're trying to understand that phenomenon. There's what we call the relative hazard ratio. We are seeing a lowering of that in those with primary infection, but much higher peak is increasing those who have had previous infection, wave 1 and wave 2, particularly those who had infection in wave 3. So we're trying to understand all of this. And with that understanding, trying to lock up everybody, screaming that is already escaping the vaccine or is more transmissible, it is not backed by science. Not at all. And one thing that is also obvious is that no matter what eventually happens, it seems like we don't learn anything from the previous waves. Because I would have expected that even governments would have learned from wave 1, wave 2, wave 3. The knee-jerk reaction does not help. I mean, for example, UK locks South Africa out. But this virus has been found in Italy, in Belgium, in Hong Kong, but they can travel to the UK. So how does that stop the transmission?
I mean, I like how you have put it, and I do hope that, the authorities are listening and, of course, putting all of this in consideration. But I'd like to thank you so much, Professor Lekan Aya Yusuf, and I really hope you find a way around that restriction and come home to Lagos.
Thanks. I hope the Nigerian government also keeps sanity and keeps to the evidence. Thank you. Look forward to coming home soon.
Thank you very much. And you too.